we've been thinking that there is both a pretty daunting threat for the coming problem, the emerging problem of brain health disorders, but also a really incredible potential of brain capital and what could be done with the brain capital that is there in the world, and that Harris and others have so eloquently described. And it was only a few years ago that we really understood both the threat and the potential. And I want to thank the Brain Health Collaborative members for bringing that to our attention, because before we were thinking about the beginning of the century, what a success we'd all seen in health, that we'd had huge declines in mortality because of the fact that we thought we were really beating disease. We defeated and bent the curve in so many infectious diseases in particular. We turned things that were death sentences into chronic illnesses that could be treated and managed, like HIV/AIDS. Because of vaccines, we were driving down child mortality. That top line there is the trends in child mortality between 1990 and 2019. And so it seemed that things were really going in the right direction. And then in the older age groups, you were seeing adults living longer lives in full health. And so what you're seeing there on the left is 1990, and then the lighter green bar is 2019. And what that's showing is the remaining years of healthy life for 50 to 54-year-olds. So once you get to 50 to 54, how much healthy life do you have left? And you can see it all across the board, it was expanding. And I could have picked any number of countries here. I just wanted to show, for illustration purposes, India, Nigeria, China, Brazil, and France. Everywhere you looked, it was getting better. The picture was getting better. And so at the Institute, we thought everything's moving in the right direction. And it really took the collaborative to help us understand that there was a looming threat on the horizon. And so scientists were saying, is there an upper limit to longevity? Or could we all swim on forever, like the Greenland shark? For those of you who don't know, the Greenland shark is a scientific oddity that zoologists think lives at least 250 years, maybe even 500 years, who knows? And so were we all going to keep on swimming like the Greenland shark? Well, the piece of the puzzle that we hadn't really tackled and understood was the brain. And when you think about the brain, you have to consider that going back to in utero, the influences on the brain, negative and positive, have these lifelong impacts. And so you start with what's happening as a baby, and then as you get into adolescence and early adulthood, you're layering in mental health challenges. You're layering in depression and anxiety and bipolar, schizophrenia. Then when you get to the older age groups is when we really start to see that cerebrovascular disorders and neurological disorders are determining how much of that extra life we're going to spend in full health. Can we really swim on forever like the Greenland shark? Or are we going to be increasingly hobbled by the limitations given to us by cerebrovascular and neurological disorders? And so that big picture of how these conditions are affecting us kept coming up inside IHME. And really, I have to thank Roche and my colleagues at Roche, Jan, Simona, Mikkel, and others I see in the room, for helping us see the vision of how do we wrap these brain health conditions together and then show the world the true impact. And it's a staggering impact. I mean, we've seen a 64% increase in the cases related to brain health. So things like MS, migraine, epilepsy, all those things combined, a 64% increase over the last 3 decades. Most people don't think that, though. They think that brain health disorders are not the biggest problem. They think of something like cancer or cardiovascular. They think of other things first because maybe they've impacted them personally, or they're scared of it because it has such a debilitating effect so rapidly. Brain disorders creep up and they can be invisible and we don't talk about them. There's stigma associated with them. But when you look at it holistically, as you see here on the far right, the green bar there is all the brain disorders combined. The healthy years of life lost due to brain disorders is bigger than cardiovascular even, and it's actually quite a bit bigger than the cancers. The typical person doesn't think that. And why is that? Why do people not understand that? Why are they not talking about it in that way? Well, big part of it is that they aren't understanding some of these macro trends. And one of the big trends here is that we're seeing as people grow and age, as some of us have talked about and others will allude to, we're going to see the effects more and more on our parents, on our grandparents, on ourselves. And that elderly group 65 plus is really starting to increase as you're looking out to 2050. And so we're going to see this increasing effect on health systems, on governments, payers unable to deal with the problem. And so IHME, for the first time, again, thanks to Roche and others in the collaborative, has been able to calculate the initial economic impact of all these combined effects. And what we're seeing is that just in lost income, it's $1 trillion annually, which is, again, one of those things that the typical person has a hard time even getting their brain around. What does $1 trillion even mean? So to illustrate it, if you just say to yourself, 1 year, $1 trillion lost, it's like wiping out the GDP of Saudi Arabia. So you take that out. Then over 5 years' time, you'd be wiping out Kazakhstan, Denmark, Nigeria, Turkey, and even India. Economic impact, output lost over 5 years' time. And that, again, is just lost income. When you start to bring in all the other economic impacts that we are now studying and that we're going to be publishing on, you're going to be doubling that number and then even more so. But what if we could not just think about this as a doom and gloom story, but think about how do we recoup some of that loss and make investments? What could health systems do? What could governments do? What kind of critical infrastructure could they fund? Bridges that they could build, schools they could build, hospitals they could build. As I note here, things they could do in aviation and space exploration. So if we just put the $1 trillion in context again, if you took that trillion and started to make some changes to mitigate the effects of brain health and to prevent the problems of brain health, in addition to that, you can be doing things like building 76 space rockets in a year, building 4,000 large and well-resourced hospitals just in Nigeria, based on the cost of building a hospital in Nigeria, and then enough electric school buses to transport every child in the UK and Europe. So it's not an insignificant number. It's an amazing potential, getting back to this idea of the brain capital and as Frederick said, the brain wealth. It's this amazing opportunity that we have to start to solve the problem of brain health over time, and then to turn the funding and the energy and the attention and the resources to things that are going to make us live longer and healthier lives. Really, the cost of doing something about it, the cost of action far outweighs the cost of inaction. So I would encourage all of you in the room to take the data, the findings, the kind of narrative that we've been able to share, and to use it in your own purposes. I mean, the seeds for everything that we need, all the talent, all the tools are right here to do something to improve access, to do something to improve equity, do something to find novel innovations. It's all here. And so we can move toward that better future. We can move toward a future in which we don't just shrug our shoulders and feel daunted by the coming problem of brain health, but that we are actually thinking about how are we shaping a world that we all want to live in. So thank you, everybody. Thanks again, Fred and Stephanie, for convening, and thanks, Harris. And I look forward to hearing the rest of the conversation to come.
Thank you. Thank you very much, Bill. And I just feel that after that presentation, we all feel like sharks in the room. But I would invite everyone to still be kind to each other, right? But Bill, thanks for demonstrating what was also prominent in our thinking. Successes in public health are actually providing a sense of responsibility in actually the causality, and what you said about the cost of inaction versus the value of action resonates very strongly. It's now my pleasure to welcome a co-convener of today's meeting. It's my opportunity to maybe make the first test about the color cards. Who doesn't know Harris? All right, so Harris, it seems you need no introduction, but you're going to talk to us about public and private perspectives in brain capital. So over to you. Oh, you use the one you like. Harris, are you making the intro about brain capital and its origin in Canada and all the rest of it? Or should I?
You do that.
I do that? Okay. So I was asked, because obviously Harris and I have interacted quite a lot, and were really eager to advance, you know, the notion of brain capital and bring it to Europe to really advance our narrative. You know, EBC is around the block for more than 20 years, and reinventing our messages is really key to us. But as we were doing so, we had colleagues and friends back in Canada who said, "Hey guys, you're like agitating yourself with a concept that is like long-standing. We invented it." So say, right? I mean, what do you mean? And obviously, this concept was born in Canada when they were putting together the concept of brain health and brain skills, but also brain well-being. So they asked us to really convey that word and making sure that it was acknowledged. So we want all of you to know that the Mental Health International is really standing behind this. But in doing so, and I'm saying this really jokingly because we are really working in the spirit of collaboration and friendship. We really see with the brain capital concept that the brain as being an asset in which we ought to invest. It's not only investment in research, but it's also a daily investment into our own personal brain health. And we are really keen on advancing this. So Harris, you are one of the big promoters behind that, and you're likely to announce to us that the Wikipedia page is about to be launched. It's like, yeah, okay.
Soon, yes, we were going to make a Wikipedia page on brain capital just to, you know, formalize things more.
Over to
So
you.
thanks so much, Fred. Thanks to Fred and Steph for co-organizing, and to Jan and the Roche team as well. Let's not talk today at all about the differences between Belgian chocolate and Swiss chocolate, because Fred will get very sad if we propose that Swiss is better. So thanks for everyone for being here, to old friends and to new friends that have already been made this morning. This conference, even before we started, was valuable because of the tremendous strategic discussions we had yesterday and this morning. So it's just really terrific. I'd say, as you guys all are, come today with an open mind and be ready to dig in and discuss and move towards this common goal of brain health or brain capital, whatever we want to call it. Maybe I should say to start with as well, we know brain capital is two things. It's brain health and it's brain skills. And on the, you know, all of you guys are very expert in brain health, but it's important to say we have a few people in the audience today that are experts in skills, in education, workforce. Eckhart is my friend over there, I'm going to point out, who's a very senior economist with the International Labor Organization. So I think Eckhart, put your hand up. We need to make friends with people like Eckhart to thread between the health sector of what we want to do and then the labor and industrial sectors. And there, another colleague, Ayadi, is an expert in labor markets as well. So anyway, it just goes to show we have some very interesting people here that are cross-connecting. I want to talk today very briefly about this big idea for 2024. This is the first time I've talked about it publicly in this kind of forum. It's the idea that we need to transition our economy to a brain economy. It's big thinking. It was inspired significantly by George inviting me to the World Economic Forum. I thought, what can I bring to the World Economic Forum that's going to have weight? And so I'm proposing that we need to move from a brain unhealthy economy, which is typified by the statistics that Bill just showed. Our economy right now is not brain healthy. We're not getting a handle on mental and neurological disorders. We need a complete transition to a brain healthy economy, or a brain health or a brain economy. And so that's what I'm proposing. We've already talked about how our brains are our most important asset. We need business leaders and politicians to say that brain capital deserves as much thought as GDP and road and bridge infrastructure. That's the level that we want to be operating at. So all of you in the room are part of this kind of coalition of the willing in your jurisdictions, in your businesses, in your organizations, to push this narrative so that we can get more funding, more policy attention to this area that we so care so much about. Interestingly, we think about a brain economy transition, we can take lessons from climate and nature. We know that we've been living in a nature unhealthy economy, right? With like lots of fossil fuel extraction and air pollution and plastic pollution, ecological destruction. So the nature and climate world is moving to a nature healthy economy where we're investing more in renewable energies and reinvigorating ecology. That's what, so I just share that with you. That's what we're doing with this brain economy transition. We're learning from nature people. And so nature scientists need the world to understand that the Earth is like a giant organism, Mother Earth, and all things, forestry, ecology are connected. So that's what nature people want us to know. So we need the world to know that global human society is one vast brain connected by devices, media, and culture. And we're all acting like neurons. All of us are kind of like neurons in this sort of vast global brain in a sense. So I just share that with you. It was offered to me by a storyteller. I thought it was quite useful to think about things in that construct. Bill has mentioned that the current cost of brain and mental health disorders is unsustainable. That's a given. So it's hampering the economic security of nations. And the G7 in 2023 talked about economic security as critical. They didn't talk enough about brain health. So we need to make sure that they understand that brain health disorders are impacting the economic security of nations. These are some of the examples of the brain unhealthy economy. We're going to talk about this today in much more detail. Burden of brain health disorders, air pollution, industrialized food. I won't go through this long list. Mis and disinformation is one of the top risks that's creating people to be very stressed and unsure about what's real and what's not real. It was mentioned as the #1 risk by the World Economic Forum's risk report this year. The results of a brain unhealthy economy, as Norman alluded to so eloquently, is reduced productivity, economic insecurity, things like this. So this is big stuff, and I'm encouraging us all to get involved in these big narratives at state or national levels. So we need to transition to a brain economy. That's my fundamental thesis for today. We need to take lessons from the nature economy transition, where we were destroying ecological diversity, and now we're trying to build back ecological diversity. So again, that's the point. We have talked about the brain economy in a couple of papers, published one in the Malaysian Journal of Medical Sciences that was published because we wanted to demonstrate that we're operating all around the world, in Southeast Asia included. We had co-authors there from Africa and Latin America. And we just published this paper today on the right in Lancet Neurology. So if anyone's interested, you can Google it. It just came up this morning. And again, thanks to George for the invitation to the World Economic Forum to expose. Yeah. You were asking such good questions. I got so excited to answer them, so I leaned forward. Also important to say that it's not just our economy that impacts our brains impact the economy. Our brains determine creativity, productivity, social cohesion, pro-sociality. So this is bi-directional. Brains and economy are interacting together. I'm going to skip over this. We need to celebrate today exemplar projects that are pushing us in the direction of a brain economy transition. Davos Alzheimer's Collaborative, George will talk about. Norman mentioned Kooth and their great work in California and the UK. George will probably also mention the Brain Health Business Collaborative, trying to infuse brain health into the labor markets of private companies and nonprofits and other public companies. We need to celebrate and empower key methodologies. So Claudio will talk about the Swiss Brain Health Plan. We want to develop a brain health plan toolkit for countries and states around the world so that people can generate their own ecologically, culturally relevant brain health plan in their own jurisdiction. And there are other people from Finland and Sweden that are doing great work in this regard too. McKinsey, Kana Enomoto, partner from McKinsey that leads their brain health. She's not here yet. She'll be talking later today. She has a wonderful 4P model for developing deep systems change in the world. The Lighthouse Life Science Project, Tina will talk about, which is a wonderful public-private partnership backed by the Danish government, Lundbeck, Novo Nordisk, and the Wheel Neuro Hub, which Roche is deeply involved in, which is another public-private partnership to drive neurological and psychiatric drug development. We have big plans this year to engage with the G7, G20, and these other types of fora. Some of these are confirmed, some of these are in process, but we're really trying to build this platform. And so we have these platforms, and we often will invite many of you to come and speak at them because it's one thing to have a platform. It's another thing we need really good content to convince politicians and senior business leaders. So I leave you again with this point that we're all connected ecologically and nature-wise. We need to protect the planet. Similarly, with our brain, we're all really connected by our devices and culture. So thank you, and looking forward to discussions today.
Thanks a lot, Harris. And just to reconfirm, this is not a meeting around wildlife and shark preservation, right? It's okay, fine. No, most seriously, thanks a lot for this insight and sharing. I mean, this for the first time in public, as you said. Definitely a topic for conversation later on when we will have our panel and guided discussion. Certainly a few things where we are going to come back to, and in our case, particularly the toolkit on national brain health plans. Speaking of which, our last presentation before the panel, it's my privilege to introduce Vice President of the European Brain Council, Professor Claudio Bassetti. Claudio is also the past president of the European Academy of Neurology, as well as the lead of the Swiss Brain Health Plan. So, Claudio, I'd like to invite you to the floor to give us an insight of the launch of the Swedish Brain Health Plan, the Swiss Brain Health Plan. Sorry, I keep confusing the two since I was on the plane with Anna last night. But okay, sorry about that. Claudio, over to you.
Either one. Thank you, Fred. It's a great pleasure to be here, and I share the feeling that we should not only talk about the burden and the problems, but we do see chances and opportunities for the future. And with this very optimistic approach to this issue, I'm here to say a few words about what Europe is doing. None of us really has a complete mapping of what's happening in the different nations, so I will concentrate mainly then on some of the activities that we are developing in Switzerland, which may become inspiration and opportunity for exchange for others. By the way, if you're looking for sun and beautiful weather, you have to move 1 hour away. Bern is offering throughout the year sun, good mood, beautiful chocolate, etc. So please keep this in mind. So we know why we are here, so I will not dig into the background of why we think this is an important issue. I'm not sure why it's moving. We are dealing with a very high burden, which is increasing because of aging. We know that the disability data have been shown is very high, and for neurological disorders and brain disorders among the top 5, and there are an increasing burden also in terms of costs. The WHO has triggered thoughts and initiatives with these 2 important papers that were published in 2022. I'm not sure why it's moving so fast. There is something wrong in the presentation. And this is the base for many of the activities that in Europe and across the world have been developed. Now, I was asked to say a few words. Now it's blocked. Maybe push the next. So these are the 2 papers that actually triggered lots of thoughts and initiatives. And I mentioned 2 of several ones that have been developed in Europe. The first one was of the European Academy of Neurology, and Fred mentioned this. This was actually a plan that is now being developed at European level by the European Academy of Neurology with the slogan, "One Brain, One Life, One Approach." And the EBC has been promoting many initiatives, many exchanges like this, like the last one we had in New York. And we are preparing also a paper on the European Partnership Brain Health Strategic Research and Innovation Agenda. Now, as I mentioned, next, I'm aware of only 4 plans in Europe that have been launched. And even if you check in the internet, it may be difficult to get all the information because some of these plans are published only in the national language. Norway was the first one, and we all have big admiration for what they started in 2018. Germany published a very interesting, I would say, very holistic brain plan. Holistic because it includes psychiatry, neurology, pediatric, and I would say the idea that a brain plan should involve all the disorders of the brain across disciplines. We followed in 2023, and we have Finland who actually joined this leading group in 2023. I'm aware of plans, some of them more concrete than others, in Poland, Ireland, Austria, Denmark, and Italy. So I do think that what we should do is really try to, and Sweden was mentioned, I was not aware, and I think we should think about bringing these people together to exchange experiences and also ideas, because we should really create a connection across the different initiatives. Next slide. So the Swiss plan was actually launched in 2022, and the first big difficulty was to bring people at the table. I mean, all the stakeholders, neurologists, psychiatrists, prevention people, patient organization, health organization, and this was the big effort, I would say, of the first year. And this led then to the publication of this paper, which actually represents this effort. I'm happy to say that we had also already international contributions. Bill Heisel is there, Professor Südow, Nobel awardee of medicine, and many others, just showing that the Swiss Brain Health Plan want to connect in the world and promote, this dialogue across disciplines, but also across countries. Next slide. Now, the strategic pillars have been a long discussion, and we agreed on these 5. The first one is awareness, what we're doing all the time. I'm sure that we don't have to discuss how little is known about the prevalence of the problem, the burden, the stigma, etc. Education is very important, interprofessional. Even Switzerland is facing a big problem with working force. Not only neurologists, psychiatrists, but also other health professionals. We need to rethink how we want to address education about brain health and brain disorders. And this is even more important, obviously, for the less advantaged countries. We have heard about the determinants. Actually, we need to understand better the mechanism of brain disorders. We have so much that we need to understand. We do have ways to prevent brain disorders, but many of them are still non-preventable. So we need to foster research on how brain disorders occur. Then we have to build up a synergy about those that are involved in prevention. I would say here politicians are very important. And last but not least, I think patient and patient organization are crucial. And this is why they are involved in our plan from the beginning. So these are the strategic pillars. Let me show you some concrete initiatives that we have started, because eventually it boils down then to concrete steps. This is, I would say, the nebulous overarching approach, but we need to become concrete. Let me show you what we are doing in Switzerland. Next slide. Well, we started with a big kickoff, and we were almost about to get the mandate. So the president of our government agreed to be there. Then eventually he stepped down from the position. He will take maybe an important position internationally, but he wrote at least the welcome. And we have a very complicated health system in Switzerland with health ministers across the different cantons, and the president of this conference of health ministers is very passionate about brain health. So I think Mr. Engelberger, with whom we will meet in April, will be certainly a supporter of what we do. And at the kickoff, we actually walked the talk, and we had representatives from all stakeholders, which was exciting and also somewhat challenging when trying to concretize what we plan to do. Let's get to 2024. What were we doing? Next slide. So implementation, few examples. Next slide. So we are thinking of having data to talk with the politicians. We cannot talk just in general. We need to have data to convince them about the problem. So we have been discussing with Bill and the EMEA the creation now of a data set from Switzerland. The data are there on brain disorders, and within the EAN we are working to produce now a data set on neurological disorders. So we will publish a paper on the burden of Swiss disorders, Swiss brain disorders, and this may become an approach that could be then taken over by the other countries. So, and the idea is that if we present data, they should be updated, and this could be like a monitoring, could be like a cockpit where we see what's happening, and we see also how intervention may influence the development of this burden. So this is something that we are discussing, and I met Bill this morning, and we'll be presenting the data this year. Next, we have decided to promote education across different professions, and this is why we have now a certificate of advanced studies, a university degree that will be opened to the world in December. It's been accepted by the faculty and the university, and you have seen the flyer, and I would like here to ask to join us. We want to have an international faculty, and if other universities would join, we would be happy. We are validating a brain health score I will show you in a moment, and one of the drivers of health, but also of the brain disorders, are sleep, and we plan there a think tank with the support of the WHO. Next. We have a very interesting project about promoting friendly workspace in hospitals, and this is an initiative of one of our partners, the Headache Society. In Switzerland, headache is the most important driving force of the burden of brain disorders among all disorders. Next one. And then we plan a special issue of our journal on brain health, and we will invite international experts to contribute to this special issue. Next. So this is the type of data we will analyze. This is coming from a collaboration with you, Bill, and your group. This shows the dailies in Switzerland related to brain disorders. In a glimpse, you see that mental disorders are the drivers of young people, and then neurological disorders, to which also stroke belongs, are coming actually with older age. So we need to have a comprehensive approach. We should not focus only on aging or on one disorder, but there is a big comorbidity between neurological and mental disorders, and we need to foster the crosstalk and the collaboration and not divide ages, disciplines, or disorders. So this is the type of data we will prepare and present. Next, another example. We are working on the validation of the Swiss Brain Health Score, in which we have now been measuring medical history and lifestyle, nutrition, physical activity, sleep, and mental and social. The idea is to develop a score that will then be given to the patient as a motivation to improve. So this is not like a driving stop, you know, when you cannot drive, but it's really to promote a positive attitude. And visit 1, visit 2, visit 3 is actually to look how the intervention may improve this kind of scores, and we are obviously validating it. Maximum, we should have all 100, and we all probably around 20, but let's see how this will be validated. Next. The migraine-friendly workspace is very concrete. We have now interest of different working organizations, including our hospital. It's about empowerment, enrichment, and engagement. We want to promote workspace that improve the situation for patients with headaches, 20% of the population. So this is an initiative which is extremely successful already now in Switzerland. Next slide. We have this certificate. Our dream is to create a master, international master, and this is open to all professions. And I would like to have so many flags over there that you can see the title. So we invite you to join us and support us. It has been approved by the medical faculty, so this is going to be a university certificate. Next slide. We are planning a think tank on sleep, the burden and the needs and gaps. We have published just a paper on how sleep is important for health and brain health. Diet, exercise, mental and physical, social interactions are drivers of health, and there are lots of gaps. We don't also know exactly how to measure the burden of sleep disorder, so there are lots of gaps, and this is what we plan in October in the beautiful city of Lugano. And then the last slide. I invite you all to join us in Bern at the Paul Klee Museum, where we will have the second stakeholder meeting of the Swiss Brain Health Plan, where I would like to see you all again. Thank you.
Thank you very much, Claudio. I guess that you're committing to sunshine in December in Bern then. It's like, okay, perfect. It's no, and thank you, Claudio, for this perspective, because actually this is part also of an agenda that we would like to push, and I'm making another element of self-promotion in the spirit of EBC, is that in May, we are gathering in Croatia, in Pula, sunshine, ? But to meet with all the national brain councils and share experience such as the one Claudio just presented, in order really to spearhead the reflection and the development of those national plans. And you are obviously more than welcome to join us on that occasion, and more is going to be shared with you as we are preparing that meeting. We are now opening our first panel, and Michael, I see that you magically appeared already on stage. I also would like to invite Kevin Rostasi to join me here on stage. And we have on our virtual stage also Tim and Carmen. Can I check if, oh, Tim and Carmen, that's wonderful. I mean, great. Thanks for making it happen. So Michael Ipperli, you are the leader for Global Integrated Program, Brain Health and Neurology Healthcare Ecosystem at Roche. You will provide us with your perspective in a moment. Kevin, you're the president of the EPNS, the European Pediatric Neurology Society, key member within EBC's membership. Also eager to hear from you. And we have online and on the screen Carmen Moreno, who is the chair of the Child and Adolescent Neuropsychopharmacology Network at ECNP, the European College of Neuropsychopharmacology, another member of EBC. And Carmen, you're a child and adult psychiatrist in Madrid. And Tim, are you joining us from the US right now? Is it the middle of the night for you? Well,
Yes.
Then,
Well, it's not the middle of the night. It's
then we are
in the-
really appreciative of you making the effort then to be with us. So you are the Center for School Study Council, is that right? Yeah.
Yes,
Okay.
that's correct.
Awesome. So I'm tempted to say ladies first. So Michael, I would like to turn to you to provide us with your perspective on the topic of health clinical innovation in children and youth. Over to you.
Hi, everyone, and thank you to EBC and Baker Institute and Brain Capital Alliance for having me here. As Fred mentioned, I'm a global integrated program lead at Roche, focusing on brain health and women's health. But actually, my expertise is not in any particular disease area. It's in improving the quality of healthcare, specifically patient safety, patient satisfaction, clinical processes, and outcomes. And the first part of my training is always to try to understand and elevate the voice of the stakeholder whose problem we're trying to solve. So I really appreciate we have Orla Galvin on the panel later, or not on the panel, but on the agenda later today, representing EFNA and the patient community. And in this panel, I'm also going to try to do my best to represent the patient community by thinking through the context of what I would want for my 5-year-old daughter or one of my loved ones. I'll leave the clinical expertise to my esteemed panelists and take the perspective of a parent who also happens to work in healthcare. So we already heard before, the World Health Organization has 5 determinants of brain health, being physical health, healthy environments, safety and security, learning and social connections, and access to quality services. And I'd love to start by just sharing a personal anecdote when just one of those areas is compromised. So I'm an aunt to 3 boys and 4 girls, and 2 of my nieces, I'm just going to call them Ginny and Bee, are both close in age and grew up in the same city. Growing up, I would describe Ginny as being fearless, confident, social, and Bee as being kind and reserved. Both girls, smart, social, capable, but of the 2, Ginny was the clear leader. Now, Ginny grew up in an environment where her dad was a fireman, and unfortunately, he got injured on the job and suffered very debilitating back pain, so much so that it created a lot of stress at home and limited his quality interactions with his family. Ginny's parents were divorced when she was in her teens, and she spent periods of time where she didn't talk to or interact with her dad. In addition, Ginny's grandma, who is a kind, wonderful person and who Ginny's very close with, would sometimes flippantly say, Ginny's not that smart at school. School's not her thing. So Ginny's primary social connection was not really fostering a persona that would promote success. I would say from the outside, she was loved, but not uplifted. In contrast, her cousin Bee grew up in a family where her parents often fought, it's true, but they always made up in a public way to show that their relationship and the family was stable and secure. Bee's mom's a lawyer and her dad is a salesman, so they would argue and debate anything and everything, and taught their kids that it's important to have an opinion, stand behind it, and talk through all issues of importance. You don't always have to agree with someone else, but you have to show respect for them. They described B as someone who had a good head on her shoulders, and always made a point to highlight the unique qualities of each of their kids, one being great at volleyball, another a skilled makeup artist, B was great at robotics. Okay, so now fast forward a few years. B is currently a university student, enjoying life and planning to go to law school when she graduates. Ginny, on the other hand, has dropped out of community college, which for those of you who don't know, in the United States, that's like a precursor to an associate's degree. She's a recovering drug and alcohol addict, and she works a minimum wage job. So for me, regardless of the inherent intellect of both girls, one was set up for better educational attainment, better mental resilience, employment opportunities, and financial stability. So when we're talking about the brain capitals of our country, I think it's really important to focus on that safety and security and all 5 determinants of brain health in order to, or through protective and supportive environments at home, at school, and in our communities. And I know our topic today is clinical innovation in children and youth, but I hope we can talk about all innovation in order to help our children reach their developmental potential. So I look forward to the discussion.
No, thanks, Mikhail. And I think when we talk about children and youth, it's very complicated to escape the topic of brain development. I think the story you just shared is quite telling. From a more personal perspective, I was also struck when the PISA study came out. So this EU kind of benchmarking of educational system around Europe, to see the country I know best performing, or let's say underperforming in that context, but also analysts saying how important this is in determining and putting kids on the right track for the rest of their life. It's not only like scoring in a one-off picture that would be taken in that sort of study being made from a kind of high-level spheres. It's probably a good transition to invite Tim to comment. Tim, can you maybe tell us more about your work at the Center for School Study Councils in Pennsylvania? And I mean, whether Mikhail's story resonates with the contribution you'd like to provide us.
Yes, thank you so much. And I hope that you all can hear me clearly. It's an honor to be with you this morning. It is 5 or 8 minutes after 5 here in Pennsylvania. Nonetheless, Mikhail's story resonates on so many different levels. The Center for School Study Councils has been in existence for 85 years. It came together and really evolved to address central concerns similar to Mikhail's story about her nieces. Superintendents were responsible for systems that were not serving everyone and everyone well. And when there are outliers and we're not intentional about understanding why those outliers exist, we have a challenge. What I've found in my communication and what I've learned from Harris, who invited me here, and I'm really grateful for this opportunity, is that brain health and brain skills can give us a common language. It can establish a glossary of terms that eradicates a lot of the differences that we unfortunately see in our political arena and experience through different forms or mediums of information. That said, the outcomes for Mikhail's nieces, unfortunately, are not unique to the two of them. We've absolutely recognized, and I don't want to get too far off a topic, but epigenetic realities for young people are pervasive. It's not just what they're born with, it's also the environment with which they inherit. And most of the time, they don't select that environment. At the University of Pennsylvania, in our Graduate School of Education, where my center sits, we are being intentional about not only collecting voice, but understanding how we need to be innovative as an institution and see these issues connected to the brain as facilitators of equity, facilitators of understanding that transforms along the life cycle. I'll end with this. As I've listened to individuals this morning, and I've been on from the start, and I'm grateful that I've had this access. What has resonated with me is how education as a sector could be the nexus for changing the narrative as it pertains to brain health and brain skills. Everyone across the lifespan is impacted by education, especially K-12 education. In the United States, most of the time, there is an ecosystem that's supporting every child that comes to school. And if we are able to develop narratives that are situated in asset thinking and not deficit thinking, and give individuals common conversational tools that they can use to begin to change the narrative about how we think, we will be off to a good start. And so I'm really looking forward to learning more, listening more, and where necessary, contributing. I'll leave you all with this. Bishop Desmond Tutu said, there comes a time where we cannot keep pulling people out of the river. We have to go upstream and find out why they're falling in. I believe that the work that is happening with brain health and brain skill development, developing capacity, that's allowing us to go upstream and see why people are falling in and do some prevention. Thank you.
Thank you. Thank you very much, Tim. I think it definitely resonates strongly with topics that we have addressed already, but I'm now pleased that we've got two doctors on the panel, as we now have, let's say, an idea of the magnitude of the problem. Maybe Kevin, I'd like to invite you first to comment on that from your perspective as a child neurologist, but also as president of the EPNS, the Pediatric Neurology Society.
Thanks for inviting me to this panel. I would like to say a couple of words to my organization, which is the EPNS, the Pediatric Neurology Association in Europe. We have around nearly 2,800 members, and we are represented in around 44 countries in Europe, plus other countries such as Kazakhstan. And one of the important aspects from your work and the EBC and the IGAP is that we are trying to implement via our members, our national society members of each country, the brain plan on the national level. We had a meeting recently with all the national representatives of our country, and they are trying now to bring the pediatric neurology perspective into the respective brain plans. And there will be a next meeting in March where the steps will be concretized. And the importance is that in every European country and additional countries, there's awareness that pediatric neurology and the aspects of the developing child should be included in the brain plan. I think that's a very important step, as you alluded, or the other speakers alluded, that brain health does not start at 18 or 20, but it starts basically in pregnancy or even before pregnancy.
Yeah, no, I mean, I have an immediate follow-up question here. Do you feel that the IGAP is a tool for action that is fit for purpose to answer those needs? And to what extent can it drive this policy awareness in the work that you're doing for children and adolescents?
Yeah, I think, for example, the IGAP and the focus on stroke and epilepsy in children is a very good initiating tool also to allude to other problems which are pediatric neurologists facing. Yeah, I think that the toolkit provided is very good, actually.
Excellent. Okay.
But we need to transform it into practice. That's the key issue.
That's the challenge we now have. Yeah, indeed. Carmen, I'd like to bring you in from your perspective as a child and adult psychiatrist. I mean, how do you resonate in relation to what you heard so far from Michael, Tim, and Kevin?
First of all, thank you very much for having me. It's really a pleasure to be in this forum. And it's really interesting and important that we are dealing with child health. I really think this is a change, a global change. And this is a very new thing. So I really want to congratulate the European Brain Council for taking the lead on that. And for aligning with other, initiatives. So I'm here because I'm chairing the Child and Adolescent Network within the ECMP. We are really putting together efforts from people from many countries. We have now in that network members from more than 20 countries. And what we do is try and put together brilliant minds and also many stakeholders to really understand what we need to do to promote brain health and to prevent the chronicity and the starting of the problems in child psychiatry, right? We now know that almost 50% of illnesses, the child psychiatry illnesses, account for 50% of the whole range of psychiatric problems. So we really are dealing with illnesses that start below age 18 in many cases. The problem is that we don't get too early to either prevent them or to either treat them, diagnose them and treat them. So it's wonderful that we are putting the eye on this age range. You mentioned before that developmental aspects are key, and I really think that developmental aspects have been very understudied, and that really understanding where and when to act is definitely something we need to do and something we should be really joining forces more. We just developed recently a position paper within our network, but also inviting and very specifically inviting patients and parents, and we collected really the input of many people through national and European associations to try and understand what are the needs of people and what are the desired outcomes for our interventions. And we really got to understand that we are not that aligned as we would like to be. That what we are really studying in science is not exactly all the time what people are worried about. That we may be focused on efficacy, but the efficacy that people want to see may be slightly different or totally different sometimes. That sometimes we don't really have into consideration how important and key are safety issues in pediatric population. And that sometimes we are reaching a little later on understanding prevention as a key factor and understanding the determinants of the problematic that arise early in adulthood. And everyone gets a space out, and we just have to this interesting case vignette, real case vignette, right? Of a perspective of someone who has a good eye and can understand that how you see something may determine how this ends happening. And there are many views to that. So we're really trying to understand and consolidate what are the needs that we need to address. We know that many child disorders still have not been studied in terms of pharma treatments, for instance. Suicide, very low studies still on depression compared to the burden on ADHD. Is the most developed, but still there are unmet needs. But we know that there's a high rate of people that's being treated with these medications. So there's something bad, we don't know enough, and still we have problems. We as doctors, we have to treat these people. This may also be because there are no other treatments available. So we know psychotherapy works. The problem is that our system, as someone mentioned just before, is not ready just to put in place some of the knowledge we have. So many different things here. I'm really happy to have the opportunity to bring some thoughts into the discussion that we may be developing now. Thank you.
Thank you. Thank you very much, Carmen. I'll probably, Michael, you want to respond to that?
I just was hoping that I could quickly expand and reflect. We've been talking about the scope of the problem and, 20% of mental disorders affect children, but I'm just noticing that we're all representing developed countries. And one of the statistics that I find really compelling in this space is that 43%, so almost half of children under the age 5 and lower and middle income countries are at risk of not meeting their developmental potential due to stunting and extreme poverty. So, I mean, if that's not a punch in the gut, I don't know what is. I'm sorry, I just wanted to jump in and share.
No, absolutely. But that's actually one of the questions I wanted to throw at you and maybe Tim as well is what is the lens that you're putting on the magnitude and the scale of the issues that we just identified? Because it's so multifaceted, and coming up with those statistics. Another one that is striking me is like 1 in 6 living with a severe mental disorder. Half of them would have the onset of those diseases before the age of 14. So that really means that the work of Kevin, the work of Carmen, and all their colleagues is really, really key to the future of our society. But coming back on to your point, I mean, what's your view on the scale and the need for action there?
I think we've got the expert Bill in house. So I only have a few of the statistics that I retain in my head, but Tim, maybe if you want to expand on that.
Sure. And to your point, Mikkel, I'm certain there are experts in the room. What I will say is that if we perspective take within the silo of our own experience, then unfortunately, we're going to miss the whole reason for this convening and the whole reason why this work is so essential. When Harris is talking about establishing a brain economy, brain skills, brain health, and quite frankly, brain wealth, I look at it as we are unhealthy and not wealthy if the least of ours are struggling. And the least of ours are not the least American. Obviously, I'm in the United States, but the University of Pennsylvania has a global footprint, and that footprint can't be exclusionary. And what is happening to children and adolescents across the globe or around the globe, from trafficking and all types of other issues that would take us in a much different direction maybe than the conversation wants to go. But I will say that the brain challenges that we've witnessed over the last 50 years have evolved, and what they look like in different spaces and regions really require us to be not just proactive, but intentional about solutions. And passivity it can no longer be our approach. And I'm so inspired by the fact that I think it was the University of Bern has established a learning opportunity for individuals. And I believe that those opportunities need to be more broad and more available to some of the countries and institutions that Mikkel referenced, so that the young people who need the support the most have access to it.
Thank you, Tim. Actually, I'd like to invite Carmen and Kevin to comment on that, on the issue of the solutions that we are now addressing. What would be, in your view, the most impactful thing to be done in order to answer those problems? And with the sub-question, how do you think we can convince governments to actually put that in place and invest into such a solution? But what would you, I mean, from a blue sky thinking, and, forget all the limitations. It's like, what is the thing you believe needs to be done and would create the most impact?
I try to answer this question differently. For example, in my daily work, we have a clinic about 100 children with multiple sclerosis. And 20 years ago, this was, how we call it, Damocles sword. These children would not walk when they were 30. They had no higher education and often no jobs. This has completely changed with the drugs now available. I do not see any child who does not, I'm overemphasizing, does not fulfill their accomplishments possible by 18. So this is a complete different change on the individual level. But certainly this has to be embedded in education, media. I'm very impressed by your talk, how many possibilities there are. Although I think it needs the physician or the people on the side, because if you do not have people who check on migraine people, all your media stuff is not worthwhile. So that does, but all these efforts need to be embedded in personal action and bigger stuff.
Okay, thank you, Kevin. Carmen, same question to you. Impactful interventions.
Very difficult one. I'll try to summarize the main thoughts, right? So at least there are two key determinants for brain health regarding child psychiatry that we definitely need to work on. One is we need to do more about genetics. We are starting to work on that. And genetics not only to find, I mean, this is not the place where I have to explain that, right? This is not about finding one gene for everything. We are trying to understand what's the genetic contribution and all the future probably for many neurodevelopmental conditions really stand there. And also for really understanding how to provide the best care for whom within the same diagnostic conditions, right? Because right now we are treating everyone the same, and we really need to go to personalizing. So trying to understand some determinants, that might be an example. We are talking biomarkers, but try to personalize is absolutely key. On the other hand, we know that there's some cross-cutting disorder factors that have great impact, and this is trauma. And trauma is big in child psychiatry. And we know, and there's an atlas of preventable intervention, or interventions that can prevent the starting of illnesses that was published 2 years ago. And we know that trauma really increases the chances for people to have psychotic disorders, depressive disorders, not only PTSD, right? That was traumatic stress disorder, as we know. And a child trauma is particularly relevant. So we are talking about abuse, we are talking about neglect, we are talking about maltreatment, we are talking about bullying, we are talking about a number of things that can be addressed differently and that have long-lasting effects. So something to think about also and to integrate into our models of care. And on the third part would be how to get the evidence. And I'm really envious about the example that was just given, right, about medications developed for conditions. We have very much less conditions studied in child psychiatry, and probably it has to do with the difficulties of really running randomized controlled trials the way these trials have been conducted so far. And we need to go beyond and try and find evidence differently. And we know there are new ways to look for that evidence. And we know that we do have lots of data in our mental health caseloads that should be used to understand adverse events. And we should start developing things such as emulated trials that using the methodology of randomized controlled trial may really try to make something out of the longitudinal data that we have in our caseloads. So we need to invest also on new ways of getting evidence and to convincing regulators that the evidence that we get out of these new ways is also valid and is also going to be translated into the needs that we have.
Thank you. Thank you very much, Carmen. We know we are running slightly late, and I'm taking responsibility for that. I was announcing, you have a Belgian moderator, so you have to adapt to this. We have on the agenda the opportunity for guided discussion, which I'm keen to maintain. So my proposal is that we delay slightly your caffeine intake by 10 minutes, but we will really keep that moment and the 15 minutes. So I propose that we push our agenda by 10 minutes. Harris, if you've got a chance to join me on stage to help me guide the discussion. And as you're joining me, I actually had the last question for you, Michael, because I was really struck by your personal testimony here as a mother, as an aunt, but you're also coming with your Roche hat, obviously. So I kind of feel like I need to ask you, like in that role, in that second hat that you're wearing on a daily basis, what is, let's say, the pediatric strategy that you can spur within Roche, and what can we expect, or what can we kind of foresee from that angle on the various issues that we have identified so far?
Well, I can't talk about specifics, but I can say that due to the specialized nature of pediatric drug development, we utilize a pediatric strategy and advisory council. And molecule teams tend to tap into this group of pediatric specialists around the time of phase 1 to determine what our pediatric strategy should be, and then to connect with internal and external experts to execute on that strategy. So there are a number of molecules that we're studying for pediatric benefits, and stay tuned to find out more.
Okay, thanks for that. Harris, you'll come in a moment. Tim, Carmen, don't leave because we'd like you on board of that discussion. You guys, it's now up to you to work. So try and find back your color cards, because we will start with the first question on the basis of what you've just heard. Do you feel enough is being done for innovation and care for children and youth? So traffic light system. If you don't think it's enough, it's red. If you think it's enough, it's green. Okay, and obviously yellow is in the middle. Okay. A lot of red, no green. Oh, wow. Okay. So Harris, what do you make of that?
I think.
Yeah.
Well, I think traditionally the brain health community has been thinking about later life, right? Dementia prevention and late life, now a little bit in midlife. And so I think the sea of red suggests that this type of panel that we just had is important. We need to keep talking about this. We need to think about the role of schools and the education system in improving brain health. So, you know, it's good that we're doing this. I think we need to do more in child and youth brain health. Yeah.
I now would like to invite any sort of contribution, because we've talked about the magnitudes of the problem, the key challenges, a few options for solutions were kind of voiced. Has anyone in the room like a comment or maybe a two-penny solution to provide? No. Not necessarily. I see no hands raised. Not everybody at the same time. Okay. Kevin, I saw you wanted to comment on that as well.
I do work in a very underserved area, and I was struck by the fact that we do not use the whole amount of, or include not all children that would benefit. I think that's a capital we must invest.
But how do you see that as a determinant for life? I mean, that's also what I wanted to ask.
I'm not an expert, but what I hear from studies looking at education in the first 4 years and then predicting what their outcome is, and professional achievements, or that's very impressive. If the first 4 years or 5 years in education, I mean, that's a very important topic. I would like to stress one more thing. I mean, I am lucky to work the last 10 years in pediatric neurology, because so many new drugs are coming that will change the lives of these children. And there are many more to come, but it needs to be embedded in a broader support. That's probably the basic issue.
Mm-hmm.
I mean, thanks to your companies and others, it's amazing what's happening on the ground.
But you feel that the clinical innovation ecosystem for children and young adolescents is fit for purpose?
I'm actually very impressed what's happening now, but it needs to be embedded, and probably other issues which need different agendas are more important on a bigger scope, but on an individual level, severe pediatric neurology diseases, it's amazing what's happening.
So there is light at the end of the tunnel, or there is a sun behind the skies. Yeah. Okay.
I mean, I always would raise the red card, but I always want to stress that there are many.
That there is hope, as we heard this morning. Michael, you wanted to
I just wanted to ask a question back to you. Is this on? So my question back to you is that we do have pediatric medications and in MS, maybe it's more clear, but for those of you who don't know, Carmen was an author on a paper released in Lancet Psychiatry last month, and it brought up a point I wanted to emphasize and then pose to you, which is around the stigma of taking medication for mental illness. So they asked an expert or hundreds of experts with lived experience whether people thought taking medication for mental illness was bad, and 80% said yes. So even if we have the drugs, we've got issues in stigma around even taking them. Do you have any suggestions, solutions?
I can only say that.
And we can add maybe to this, aside mental health, it's also medicating kids. It's also seen very badly in a large extent.
And I can only speak for my population of children with epilepsy and MS. They see that they benefit from these medications. And usually the adherence is actually very good with the modern drugs.
Well, to build on what you said, Fred, another personal anecdote, my best friend has a son who has severe anxiety. And because her mother-in-law equates medication to failed parenting, they've kept medication as the last resort. They did end up using it to good effect, but have kept it a secret from their son's grandma, despite the fact that she watches their son multiple days a week after school. So I think it, can depend on the illness, but I do think this is a problem that we have to tackle.
I'd really like to comment on that.
Yeah, Carmen, I wanted to invite you to this.
Because I'm really happy that this subject was brought in. We need to communicate better about the benefits of the interventions, but we need also to communicate better about the magnitude of the problem. And we really need voices people raising their voice about the possibility of having a mental health problem and having a healthy life otherwise, and having a long-lasting commitment with your friends or a good employment. And we need to let people know that there are treatments that work for many conditions. So still now, this is seen as something that's going to change your life. Absolutely. If you are diagnosed with a mental health condition, it seems that this is a curse, right? That there's no change for you from now on. And that's not the reality. So we need to change the discourse and the way we talk. But that's also real that we need to have better treatments. So we have probably a different situations that people in the neurology field have. We many times don't get to have access to medications until those medications have been tried, studied, and in adults. And the way that illness manifests in kids many times is very different. So we go late, probably we don't go with the best tools, and we don't go with the best designs. And we need to really change that and to really address those points. So medication is not a bad thing. They work as they work for some conditions, still do not have data, good quality data to say that works for as many conditions as we are using that medication for. And we need to let people know that those medications are safe. And we still need data, and we really need to have the industry on board to answer many of those questions. And we know that's very difficult to deal with child psychiatry, much more so than with child neurology. And we need to talk, to cross-talk, and really make sure that we start to have first steps to build up trust on people on the interventions.
Thank you, Carmen. And George, I saw you raise your hand, and I'm so pleased we can throw the discussion back to the floor. So
thank you.
Please.
I want to thank Mikhail. I thank Roche, but Roche through you, for the work that you do around the world. But one of the great challenges, as we've seen, is these innovations have to get to people of the world and the kids of the world, right? So these interventions and these new pharmaceutical products have to be low cost, administrable by community health workers or by primary care physicians around the world, not neurologists, not experts. And the screening for these, for the people that are appropriate for these, has to be very, very low cost as well. It's a challenge. It's a major challenge for a profit-making organization to say, let me take a country, just take Kenya, Rwanda, and I am going to make available the new products that I have for neurological disorder kids and really offer at a low price and get rid of mental illness in that country. We've done it with Hep C in Egypt, right? At a cost that was unbelievably low because companies basically said, let me try and eliminate Hep C in a country of the world. So I would encourage you, as we think about these new products, and I have the same problem with Alzheimer's products, how do we get them to the people of the world? The only thing we've really taught the world is vaccines. So how do we get from where you are today with pharmaceutical interventions to a vaccine for childhood neurological disease?
Okay, so Michael, quick answer, and then I'll invite panelists to wrap up. On Norman, yeah.
I don't think I have an answer to that
Oh, okay.
question. That's a big
Okay,
one.
let me bring another question to you. Then you choose, which one you want to reply to. Norman.
Yeah, I just wanted to pick up on Carmen's point about trauma. And I mean, I'm interested in how we prevent poor mental health in the first place. It's so much better if we can avoid the problem developing in the first place. And I remember visiting Philadelphia and hearing about how you map areas of the city where trauma is most likely to happen, and gun crime and the impact of poverty and disadvantage and so forth. And of course, in those areas, there's a clear link between poor health because of trauma, but poor education because it's interrupted by the challenges that those children are going through. So I think a far greater focus on understanding where these problems of trauma are at their greatest and really focusing our efforts on those areas to prevent it happening in the first place. That, for me, is the prize that we should be pursuing.
And one of the key issue is when that mapping is seen as a precursor to determinants or even a curse, but it should actually inform policymaking in order to put those solutions in place. So I'll probably invite the 5 of you now to conclude. Maybe have a very quick word of conclusion, because you're depriving this audience to have their coffee. So Harris, you can have the start.
Okay, let me be quick. One of the unique opportunities we have today is to bring in the financial innovation lens on brain capital. So if we think about child and youth brain capital, it's really the key asset for nations in the next 10, 20, 30 years. So we have some people in the room. Ayadi is a banking and finance professor. Dan Mannix is an asset manager. Put your hand up, Dan. We're going to have a session later with them and the European Investment Bank, where we need to think, I think, about how do we engage the public pension funds and the sovereign wealth funds in investing in child and youth brain capital. What should they invest in? How do we convince them that they're concerned about climate risk in 30 to 50 years, because sovereign wealth funds are concerned that their countries may not exist in 50 years because of climate volatility. So how do we convince them that the brain capital of their country is a key asset? It's as important as climate change risk, so that we can start to engage them, the BlackRocks, the Blackstones, the Cambridge Associates. I think so. I just put that on the table, that let's talk about that as the day evolves, about how do we involve the finance.
So you mean that pension funds investing into child and youth mental health and brain health would be the ultimate achievement of today?
Yes, but how do we bring massive scale investment? They manage trillions of dollars.
Sure.
So that yes, that's what to achieve. So that's your job. That's your KPI.
Kevin?
I was most impressed today to hear that brain health and capital is on the agenda of the World Economic Forum. I mean, what more can you get? And also to see how children are at stake and regarded as an important pool for the future. So,
thank you, Kevin. Okay.
You asked what we could do to be most impactful on this topic. And my answer to that is listen to the children, understand, and then act on their needs and develop the processes to bring innovation to reality at unprecedented speeds. That's what I think we should do.
Thank you. So have the experts by experience around the table and ideally in the driving seat. A point that Claudio made also very quite eloquently. Tim? Word of conclusion?
Yes. I would just concur with Mikhail, and something Carmen said earlier that got my attention is how we customize care makes the difference. And customization comes with the voice of the individuals that need the care. And so having all of the stakeholders, internal, external, and otherwise at the table is critical, and actually goes to a few of the comments that were made from the audience in terms of how we can do it well, and do it with a certain degree of efficacy, not just efficiency.
Thank you, Tim. And Carmen, last word from you.
Oh, so I would say that investing in child mental health is going to save lots of money. We really need to communicate that this is the only way to go if we really want to improve mental health across all ages, because we start earlier than other conditions, and the problems that children have are pervasive through their lifetime in a very important percentage of cases. It's possible that we join forces. We need to join forces, people here around the table, but also those that are suffering or that have something to say about what they want. So we need to bring in other stakeholders. And I'm really happy to see that. And I look forward to continue being part of this meeting today. Thank you very much.
Thank you. Thank you very much, Carmen. Thank you, Carmen. Thank you, Tim. And please join me in thanking our panelists. And Tim, particularly to you, just hope that you can cope with the rest of your day. And good luck with that. So we'll have a coffee break right now. Please be back in the room at 12 sharp so that we can resume for the second part of the morning. Thank you. So I'm really pleased to introduce Alexander Hudson, who is Senior Advisor at Eyre, which is a very interesting organization that we had the pleasure to have on the context of our Brain Innovation Days. I'm sure Alex is going to introduce Eyre in greater detail. But Alex is working in the unit on democracy assessment. So the topic that Alex is going to cover is the state of global democracy. I just hope that he would be able to finish on a positive note, as I did earlier in introducing this meeting. So Alex, the floor is yours. Can we just check that audio connection is right? Can you start speaking?
Yeah. Can you hear me all right?
So we hear you perfectly. Alex,
Excellent.
over to you.
Well, thanks very much. Thanks to the European Brain Council and the Brain Capital Alliance, and in particular to our sort of new institutional friend Harris for the invitation to participate in this really interesting event. And I should say also, you've commented on the weather in Switzerland a few times. It's not so pleasant in Stockholm this afternoon either, but we'll try and find a way, as you said, to finish on a positive note, although the news, as you would expect, is not great about the global state of democracy. And thanks also for the introduction about International IDEA. I'll just say a couple more things. So we are an intergovernmental organization with 35 member states headquartered in Stockholm, but we have offices all around the world. And the team that I work in does a lot of research, but we have other teams that implement programs in various countries around the world. So let's see if I can get my slides moving. Here's the outline of the talk. I'll talk about the concept of democracy that we have developed and how we measure that, and then some about the global patterns of democratic expansion and contraction. And then we have this concept we want to, that we have focused the report on this year called countervailing institutions. And then I'll finish with some policy recommendations. And in the middle, we'll make a few connections to this larger concept of brain health and how that relates to democracy. So democracy, as you may have heard many times, is an essentially contested concept. So we find we all often have to say exactly what we mean by democracy. And we use two definitional principles at International IDEA, which are popular control over public decision-making and decision makers, and equality between citizens in the exercise of that control. We don't measure democracy as a singular concept, but we collect a lot of data that measure these component concepts, if you will, that we call at the top level here categories. So we have the 4 categories of democratic performance: representation, rights, participation, and the rule of law. A lot of our analysis works at a second level below that, which is what we call factors, and they're arrayed around here. One that I'm going to particularly call your attention to now is basic welfare. So we put that under rights. And here we're mostly measuring things that relate to sort of education and nutrition, but the most basic requirements that a person must have in order to participate in public life. And the discussion this morning has really made me think about whether or not we need to add to that some things around mental health and skills and other things that enable a person to participate in public life. But that's for another day. So first, the key findings of our annual flagship report, Global State of Democracy. And you will probably not be surprised to hear that there are a lot of countries with decline. So if we look at that second level of aggregation at the factor level, there 49% of countries in 2022, which is the most recent year for which we have data. We'll have the 2023 data soon. But in 2022, 49% of countries were declining in at least one factor, while 36% were advancing in at least one factor. And that doesn't mean that they are in a terrible decline, but half of the countries are experiencing decline in at least one factor. And we can take those same numbers and divide them slightly differently and say, well, each country could be declining in one area and improving in two. And so it would be net improving, or vice versa, declining in two, improving in one, net declining. And then for each year, how many countries are net positive, how many are net negative, and then the balance for the entire globe. And so what you see here is that for about 3.5 decades, every year, there were more countries that were net improving than net declining. And this tips in about 2016, where now for the last 6 years, we've had more countries that are net declining than net advancing. There are a few ways you could look at that, and you have to kind of calibrate your pessimism or optimism here. This 3.5 decade stretch of consistent progress has not been undone by 6 years of decline. And so the world remains nearly as democratic as it ever has been. But at the same time, we have experienced consistent declines now for 6 years, including in countries that we thought were established democracies, consolidated democracies, high performers in many categories. And so there is reason to be concerned, to be very concerned about the future of democracy, even if its current status is not particularly poor. Then if we look at where those problems occur, so here we have some tree maps that illustrate the proportion of countries that are advancing or declining in a number of the factors. And you'll see that in most cases, in all cases, the majority of countries are stable. But then among those that are experiencing change, the balance is tipped towards declines. And so this affects some crucial democratic institutions, such as credible elections, access to justice, effective parliament, civil liberties, and elected government. There is one exception to this overall negative trend, which is absence of corruption, where actually more countries are improving than declining. This one's a little bit odd and needs to be taken in some nuance, because some of the countries that are improving in fighting corruption are declining in other areas. And so while there is an overall positive correlation between corruption and democratic performance, it's sort of an inverted J curve where countries can be making sort of confusing progress in one area and falling behind in another. But corruption is one of these where there is some signs of hope in some countries. Another way to look at the data and try and find some good stories is to look at the relative strength of participation. So we have these 4 top-level categories that were illustrated on one of my first slides, and participation and rights are 2 of those top-level categories. And what we find is that in countries that are in relatively sort of mid-level performance on rights, you often actually have a high level of participation. And we can see this as a upon where there's clear demand. So this is behavioral, right? People are turning out to vote. They're becoming members of organizations. So they're demonstrating a willingness to be part of public life, a demand for democracy in some sense, even when rights are not being very well protected. And so this is, as I said, sort of an area where we can be hopeful. And it's also, I think, the area that is most connected to brain health. And we'll come back to that in a moment. I mentioned at the outset that we have this concept of countervailing institutions, and the report goes into some detail here, and I'm going to skip over it fairly quickly. But the idea is this. We have a long-standing concept in political theory of checks and balances. You hear it talked about all the time, I'm sure, in the media. And normally we think of that in a horizontal way. So there is an executive, and alongside it is the courts and the legislature, and they engage in some mutual checking and balancing against each other. But what we found in the data that I just showed to you actually is that there are many countries where the courts are compromised, where the legislature is ineffective or captured by the executive. And so you can't rely solely on those horizontal traditional checks and balances in order to constrain government behavior. And there we need a broader concept. And so countervailing institutions includes then both those traditional horizontal checks on power, but also the myriad other institutions and activities that can also check government power. So civil society, trade unions, the private sector, even public protests can be a form of check on government power and thus a countervailing institution. And down at the bottom, we have independent bodies that are often called fourth branch institutions in the literature today, but these are independent commissions that have a role in checking government behavior. And if we take a quick census, a look around the countervailing institutions, you find that, as we saw, credible elections and effective parliament are areas with particular trouble. And credible elections, of course, is an area of focus now, in this being the largest election year in human history. We mentioned judicial independence. There's some progress here, but more countries declining than advancing. And I'm wrapping up fairly quickly here. But participation scores are not only high in, let's say, established democracies in Europe and the Americas, but are also high in countries that have experienced significant challenges in the past few years, such as here in West Africa, Southern and East Africa, Indonesia, we mentioned earlier, Mongolia, etc. And so there is a high level of participation, as we said, in unexpected places. And this is something that we can build upon. So just to summarize, democracy continued to weaken in 2022 and 23. The declines have impacted representation and rights in every region of the world. There's this broader concept that we can harness to think about how these declines in democracy can be arrested, and this is countervailing institutions. And then that popular participation motivates progress. And I want to suggest, and there's some research that supports this, that there can be a positive interaction between democracy and mental health. And you could just draw an interaction going back and forth here, but I think we can also say that it goes through participation. That is to say that if you're in a high-performing democracy, there are lots of social factors that will support mental health, that people feel they can have a voice in their community, that they're empowered individually, and this supports mental health, which in turn supports participation, that people are then empowered, they can participate, they can form associations, they can vote, they can have a voice in their democracy. And so we could imagine some sort of positive cycle here between democracy, mental health, and participation. And of course, it goes in the other way. When we have problems in democracy, we have less participation, we have problems with people's mental health. Disinformation was mentioned earlier this morning. And certainly that's a thing that we have to think about, and how also supporting mental health can support democracy in that way. And so we have a lot of interactions here that we want to build these things together. And I believe I have used up my time, and I know timekeeping is a concern this morning, so I will stop there. And thank you again for the opportunity to participate.
Thanks a lot, Alex, and thanks for keeping to time and keeping my anxiety level as timekeeper low enough. I was really baffled by your last slides and that virtuous cycle where you emphasize the need for participation. That probably also resonates with what Norman was telling us in the introduction this morning with the post-COVID related mental ill health. That was probably also coinciding with that depleted participation in society and greater social exclusion. But seeing democracy in its societal understanding is definitely quite telling. And never ever I would have thought 10 years ago when joining a brain research organization, becoming a brain health and capital-oriented focused organization, that we would be embarking into a civic movement. But this is probably something we should definitely foresee. I'm pleased to now move on and introduce our next speaker that is going to cover the issue of neuroscience and sustainability, who is Dennis Pamlin. Dennis is the Executive Director of the Net Zero Compatibility Initiative. So I guess, Dennis, you're on the screen, you've magically appeared, and I'm really pleased to hand over to you. You've got the floor.
Thank you very much. And it's a great honor and it's exciting to be with you, even though it's virtual. So my take on this is that what you have heard so far might just be the tip of an iceberg. Brain science might be one of the most important areas moving forward. So it's not just about democracy, it's really about what society as a whole is heading. And let me just share a few slides with you here. See if I can do like this. If you see that now. Yes. So as mentioned, I was appointed executive director of this initiative that was created in Paris. And among many initiatives, the same thing have been seen. We have focused on the wrong thing. So for climate, the work has been for the last 30 years to ask, how do we reduce emissions? But that is not really the question. The question is, how can we allow people to live flourishing lives in a sustainable way? So this challenges us, and that's what we have been introduced, what we call an expanded innovation agenda. Because so much of the work right now is focusing on existing sectors and problems, including brain science. It's about optimizing current systems and trying to do what we do less bad. And that is not bad, but it's not everything. And where we found brain science to be really interesting is when we expand this and look towards the future and say, what are the human needs and who can provide for them? And then, of course, we have these basic needs. We need nutrition, we need shelter, buildings, etc., that we've been working on for decades. But the question today, and that's why we have a society that is focused on more on everything, because for all of human history, we basically had a lack of everything, of health, of nutrition, of shelter. Now that's not really the case. Some still, but overall, we actually have more than we need. So the question now has moved from just meeting the basic needs to saying, what do we really need beyond that? And that's where we found brain science to be basically the only area that has some sophisticated answers to say, what does it mean for a person to flourish? And of course, still most of brain science is about the challenges with Alzheimer's and mental decline, etc. But we think there's another side to the brain science that are equally, and in the future maybe even more important, and that is to ask, what does it requires for people to flourish? Not just to be in decline, but to be what they want to be. And that's why we also see a lot of challenges today. Many people with mental challenges today that feel depression, they don't have a lack of material things. There's lack of meaning, lack of vision, lack of the feeling of being empowered on do something, not just to vote. Many people in democracies feel that, yeah, I can participate and put my vote, but I want to do something more. I want to be part of something. And that's what we now have tried to say. If we want policymakers, if we want investors to start thinking about this, we need to create tools that are easy to use. Because investors, they can sit on thousands, 10,000, sometimes 100,000 of assets. So how can they scan those? So that's why we launched a flow mental pollution assessment, for instance, a very simplistic tool, but that can allow us to ask for certain solutions, companies or cities. Are they supporting flow or are they supporting mental pollution? And by mental pollution, we don't only mean the most negative things that are really killing us, but on a more general level, are we as the default in society now mentally polluted, including everyone now in the audience who's sitting on their smartphones, eating fast food, buying fast fashion, etc.? Have we become over dopamine triggered and lack other kinds of environments that trigger us to be more flourishing? So that's what we have, this sort of simple classification on what kind of solutions and companies do we stick with here? And that we see that a lot of money today is pushed into fast food, fast fashion, fast social media, because you can see easy, faster return of investment, because it's a self-enhancing. If you stress people, they meet the stress by consuming more. And by consuming more in many areas, they feel more frustrated because they become overweight and they feel they want to look even more fashionable with the latest fashion. And the cycle goes on. How do we tap into that with brain science? And that's what we found really exciting. But also on the other side, how can we have people having healthy nutrition, not just nutritional, but also slow food, eating with family, empowered outdoors, sports lifestyle, be active, be among friends, art creation, one of the areas that we think should be measured much more. Not just saying that people should be active in a general sense, but is there a human right? That's what we're discussing now in the post-SDG agenda, the next generation sustainability goals. Is there a human right to be creative, to give something back in arts or science that everyone on the planet should have? So these are the kind of questions we ask. And that's what we are so excited to join here. And we hope we will join collaboration with many of you in this room as we now shape. It's only a few years left on the SDGs, the global sustainability goals. But now are we rethinking what is happening? What do we really need in society? Brain science can play a huge role in that. What do we have to avoid? We have existential risk with dangerous climate change, AI, synthetic biology. We need an understanding on how we can grasp with those challenges, but also better. And that's where I think the current brain capital do a good job in saying who and what can deliver. How can we be more efficient in this? So that's just a few words from my side that I wanted to just share with you and invite anyone who wants to join. We're going to have events at COP, Davos, and other major events to really try to push the brain agenda for flourishing lives into the mainstream. Thank you very much.
Thanks a lot, Dennis. And actually, there is definitely one point on which we need to build this conversation is how to understand behaviors and our capacity to change and adapt thanks to brain science. That's probably something we will need to address either in Baku, Davos, or New York, or wherever. But very glad to initiate this collaboration and dialogue and advance that. I'd like to now move on to our second panel of this morning, moving to the topic of brain health clinical innovation in mid and late life. We will have, again, a mix of online and on-site panelists. I'd like to invite Paolo and Kwasi to join me on stage. And we have online Maria Teresa Ferretti, Peter Falcai, and Greg Ritchie, all, as we had earlier, invited to provide a short statement, and we will then launch a conversation. Paolo, you're here in your role as Global Head and SVP Neuroscience, Immunology, Ophthalmology, Infectious and Rare Diseases at Roche. That's a very long title, but, or I would say it's multiple hats. Actually, I wanted to ask you from the neuroscience perspective, how does that resonate for you? But do you see any transversality of the work you do in neuroscience in the other fields of work that falls into your remit?
Hello. Yes. So first of all, thank you for the invitation to be here, and it is really a pleasure. And I would say yes, there's a lot of connections actually, because ultimately, of course, we have to think that the thing that makes all of us who we are is our brains, but our brains don't work in isolation. So we need a healthy body to have a healthy mind. And therefore, anything that contributes to reducing the burden of chronic diseases, whether that's in immunology or in ophthalmology, et cetera, contributes to better brain health. A little known fact for, that's that as people age and they lose hearing, they lose sight, that contributes to lower cognitive functioning as well. So of course, there's a lot of connections, not just biologically, but also clinically. And therefore, yes, it is a big title, but I see it as very much part of one big happy family. Yeah.
Definitely. Thanks for that. And there are certainly some of the points that you mentioned that could resonate, and colleagues in the room, feel free to intervene or prepare questions. Maria Teresa, I'd like to turn to you. Thanks for joining online. Sorry you cannot be with us. You're joining us in a double capacity in your role as affiliated researcher in Vienna at the Medical University, but also now as a clinical development lead at Scientifique Medical. Can you tell us about your work with those two hats, but resonating with the topic of this panel?
Absolutely, my pleasure. And hi, everyone, and thanks for the invite. I would really like to bring my perspective as a scientist here. I'm a neuroscientist and neuroimmunologist. Now I'm working in the field of neuromodulation, and I'm absolutely passionate about the brain and finding solutions for the brain. But what I have learned and the perspective that I would like to bring to this conversation today is that actually there is a big gap between what we do in the lab, what we find and publish, and then what happens in the world out there. I learned there is not enough to publish a science or a Nature paper to bring solutions to people. And I have, of course, we know that this happens for multiple reasons. There are structural reasons, regulatory, payment, lack of systems in place. But the topic that actually I would like to bring to the conversation today is actually the fact that even the most amazing solution you can work on, you can research on, and maybe you publish on a biomarker, a drug, a neuromodulatory solution, even that might not work for everybody out in the big world. So this topic of personalizing and addressing specific needs of individual group of patients, that's what I would like to call attention of this audience to, and that's what I think we need to discuss. Of course, I have quite a lot of experience in gender differences, and one of the groups of patients that require specific care is women. Please allow me to mention that the humongous numbers that you have seen of burden of brain disorders that we've been discussing until now, I think somebody has to say that a lot of those actually affect women and affect more women than men. Some of the most prevalent diseases like Alzheimer, migraine, and depression, even long COVID now, affect more women than men. So we are looking at diseases that have a different impact on different groups of people, on men and women, racial differences, ethnical differences. These are differences that we need to take into considerations. And we have to do it for two reasons. One is the scientific one that, of course, I've been contributing to as a scientist. It's the right thing to do from a scientific standpoint to optimize whatever solution for the subgroup of patients that need to benefit from it. It's actually an opportunity to make things even better. And there is another level that I think it's extremely important to discuss with you today, which is brain health equity. So if we create a solution and we just give it to everybody and we expect everybody to respond the same way, this will not happen. Some people will have a benefit, some others will not. This is not equity, this is equality. And what we should struggle together, what we should really work together on, and I hope this will be the beginning of such an initiative, is to make sure that we are innovating, creating solutions that reach the people that need it and that are adapted in a way that everybody can benefit of them, because only this will be brain health equity.
Thanks a lot, Maria Teresa. It's actually already quite a handful. Although there are a few points where I see very interesting connections with what you raised, and we certainly are going to come back to that. When it comes to regulation, health system readiness, biomarkers, heterogeneity of diseases, gap between the lab and applications, we'll come to that in a moment, but I'm eager to let the other panelists make their contribution. And next is Professor Peter Falkai, who is a board member at EBC and past president of the European Psychiatric Association. Peter, it's a pleasure to have you for the first of your two contributions today. But please, over to you for your comment on the topic of the panel.
Thank you very much, Fred. Thank you very much for inviting me. Well, I'd like to take on the lead from the previous speakers, starting with neuroscience and then going to, let's say, into, more specific possibilities of diagnose and treat people. My plea would be very simple. If you want to do something about brain health, you should actually improve resilience, train resilience, and underlying resilience is plasticity. And I think it's nice to say we should, be aware of the risks. So fast food, alcohol, sedentary behavior, and other things. But I would go the other way. I would say we need to be active. And there are two things I'd like to point out. One is we need to be informed about brain health, mental health, and all the perspectives. Why that? I think there are good studies, and just like to quote one by Danuta Wasserman, where they looked at 11,000 pupils and informed them over 2.5 weeks what is all about mental health. And they did a follow-up after 6 months and 12 months. And what they found out, interestingly, that the likeliness that you develop, let's say, depressive thoughts, suicidal thoughts, was significantly reduced after 12 months. So obviously something is changing if I'm informed about how I have to be about this. The second thing is move. I think that a lot we don't do is move. And therefore I would very much support not only informing people, but getting them to move. And we have done a series of studies where we could very nicely show in mental disorders, depression, and other disorders like schizophrenia, where exercise and simple movement trains your plasticity and improves your resilience. Thanks.
Thanks a lot, Peter. You give me the perfect red carpet for two elements of self-promotion. First is an event on brain in sport organized by the European Brain Foundation in Brussels, 24th of February, on prevention and management of concussion in sport. But sport is going to be a key channel of awareness raising for the EBF. Second is that we are preparing with the team at EBC. Steph and I are certainly not the good examples here, but we've got colleagues spearheading the training of a team defending brain health on the occasion of the 20K run in Brussels, which is a major thing in the city. You're more than welcome to join under the hashtag Move for Your Brain that we have created a couple of years ago. And if you cannot join us in Brussels, you are invited to run on the same day and post on social media with that hashtag. So we really would like this to be revamped as a campaign, building on what you just said, Peter.
What day is it?
So you can join us as well, Peter.
Yes.
So,
what day is the event?
It's in May. It's in late May.
Late May.
We'll communicate the day. So okay, Pawel, you're signing up already. Great. Okay. Yeah, that's along these days. Next panelist, Kwasi. You're coming as Chief Medical Officer at Ramsay Health Care. Maybe you can tell us what Ramsay Health Care is in a nutshell. And what's your perspective on innovation mid and late life?
Hi, everyone, and thank you for the invitation to be here. And it's a great meeting. And I think what's been really powerful about it is that we're all, I think, making efforts, but it's great to see the wider world we're operating in. So, you know, I think the presentation on democracy, for example, was really eye-opening. You know, it's going to sit with me for a while, and I think that call for participation is so loud, isn't it? Anyway, I'll get back to the message. So I was a neurologist who then went on to practice in psychiatry and law, academic psychiatry, and in fact worked in Norman's Patch for a long time. And then in recent years, I've been involved in operating and scaling up mental health services. So our organization, Elysium, is one of the larger independent providers in the UK for mental health and neurological care. We very much try to move away from models of institutional care, which is highly challenging, I think, when you've got a healthcare system which I think doesn't always incentivize those moves. But we've done that. And a couple of years ago, we were acquired by Ramsay Healthcare Group, which is a global healthcare group across 10 countries, about 100,000 core employees. And I have the privilege of leading the innovation networks for mental health and brain science. So a lot of what we're talking about here is, you know, is really exciting. It's causing a lot of debate within our systems, but also we see what state systems are also doing in terms of response. I've also been CEO of a not-for-profit policy group, which is really about trying to provide guidance for countries setting up mental health services for those who are in contact with criminal justice systems. So, I mean, that's a big piece of work, but we've done a lot of work to engage low and middle income countries to provide ethical, effective care. But the broad theme is about, can we deliver high quality care to people who need it the most marginalized? And, you know, I think that has been through a collective international effort. And, you know, I'll just echo that, you know, it's often said that COVID didn't respect countries' boundaries, but actually I think most of the good things that came out of this pandemic has been through collective efforts, whether it's the collective efforts of local people in their communities helping vulnerable people, or actually the collective efforts of industry, governments, and academia to develop vaccines. So just briefly, my thoughts on this area, and I think a lot of the discussion points are coalescing, which is great if we're going through a mission-orientated approach. But I was delayed on my flight yesterday, so I read the World Economic Forum's Global Risk Report. I mean, that is not a beach time read. I mean, it's quite sobering, isn't it? And it could worry you, but I think what we're doing in terms of positive, resilient, creative strategies are really important. And, you know, I also see globally all the kind of red lights flashing for mental health in terms of global disability and how we need to move away from the issues we are in now. But, you know, like many of you, we've been working in this space for quite some time. And a lot of the effects of transformation, I think, have been hindered by healthcare systems that aren't geared for it. So, you know, we have lots of drugs that actually are, some of them are pretty effective and actually relatively cheap. There are new ones coming online, but we struggle to get them to the people that need them the most. I would actually say that a lot of the efforts of digital transformation in the last 10 years, 10, 15 years, have sometimes added barriers to the access to care. They've not always been positive in terms of delivering better care outcomes. So, but I'm also encouraged that we're seeing learning in this space. So, you know, I've been involved quite a bit in the AI space in the last year or so, and starting to see in the UK and internationally approaches towards using these technologies to actually allow better human-based care. But there's a lot more to do, and big debates on regulation and how we do that. I think what draws me to the work here is actually that mental health is integrated. It's really important, isn't it? We've already spoken about the fact that we have this interesting set of trends there. Over 50% of conditions are presenting by the age of 14, peaking in their 20s, but have an impact across the life course. And, you know, many of you will know better than I that there's still a dearth of research in the young about what happens in terms of lifetime risk for neurodegenerative conditions. So integration is important because it helps, I think, the validity of brain plans for nations. And I think in terms of their getting traction, it's important because I think a lot of the etiological pathways we're seeing for mental health conditions intersect with neurological conditions. We're learning more about inflammation and mitochondrial disease, for example, in that regard. But very simply, I think most healthcare systems are still troubled with trying to deal with co-occurring conditions, mental health and physical health conditions. How do you design that? How do you make that work in communities? So there's a real pragmatic reason to do this. And then finally, as a scientist, mental health has often been, I think, the Cinderella in terms of research funding globally. By integrating proper transdisciplinary effort, I think we're going to do a lot more in terms of finding new treatments. And just to conclude, what that means for us as an organization is that we've got a lot to do. And I think we're quite candid about that. We want to do more to improve data for mental health. So it's not just about siloed information that may be just about trying to look at reimbursement or hard clinical outcomes. Can we democratize data so it actually is available for people who are receiving care? And also, how do we look after our people? So it's not just our communities, but actually our workforce. There's been a bit of a discussion about productivity, but I see a lot of organizations focusing on well-being, and a lot of well-being efforts are quite generic. So I think there's an opportunity here to look at brain health as very discrete, specific interventions that are important, not just in terms of energizing Gen Z into the workplace, but also people who are in later stage careers who are trying to find their world in the new digital economy, and actually want to harness their experience, their wisdom, but also I think the new skills. And I think when it happens right, it's a really wonderful thing.
Okay, thanks. Well, obviously there is not much to add because you've covered a lot of those points. And when you mention AI, I actually had in my brains what was being discussed last week in Davos as to the potential of AI to transform healthcare, and whether it's a hope or a hype. But we can certainly come back to this in the course of the conversation, as well as all the many other points that you covered. Just eager to hear from Craig Ritchie, who is the CEO and founder of Scottish Brain Science. Craig, it's long time no see, and it's great to have you on that panel. And looking forward to hearing from you.
Yeah, so thanks very much, and really grateful for the invitation to participate in this panel. I think the a little bit of background. I mean, like Maria, I've been working as a clinical academic for 20-30 years in this space, and one of the things I think we've been learning over that period of time is that the disease that leads to dementia in later life are obviously generating in midlife. I think projects like Prevent Dementia and EPAD are really pointing us towards that. And I think what I've been trying to do personally and through projects like EPAD with colleagues around Europe is to really change the narrative around Alzheimer's disease to disease of midlife rather than an older person's condition presenting with dementia. And in doing so, it's opened up a series of different conversations with different stakeholders. Because I think one of the things that we've been finding is the legacy issue of the 20th century, where we're way too illness focused and not enough health focus. Because if we're going to think about primary or indeed early secondary prevention of these conditions, we're talking to a series of different stakeholders that are not traditionally the ones who've been maybe leading the work in terms of helping people with Alzheimer's disease historically. And I think that's one of the key things that drove us to establish something called Brain Health Scotland. In Scotland, we talk about democracy, we talk about agency, we talk about empowerment. Then it really does need the government to get behind initiatives which really do change that narrative and aren't illness focused but are health focused. And I was fortunate enough to meet with Nicola Sturgeon in 2019, who really threw her weight in the country's political forces behind the establishment of Brain Health Scotland. And without going into great detail about its achievements, I think one of the things to pick up on something Peter mentioned earlier is I think one of the greatest achievements we have is there's a curriculum about brain health for every 11-year-old in Scotland. So there's 20,000 children in Scotland have so far gone through a programme of, if you like, education and information sharing about brain health, which is going to, I think, set them in great, in a great position moving forward to reduce their risk of Alzheimer's disease and dementia in the future. So I think the key messages for me really are that we need to change the narrative, we need to change the stakeholders, we need to be health focused, not illness focused. And to the point Maria mentioned earlier, and she and I work very closely together in this, we have to recognize the differences between different genders, ethnicities, in the way that risk factors present, and the way that risk factors can be reduced, etc. So I think there's a long way to go, but I think what we need to do is remove ourselves from the sort of illness-focused legacy issue of the 20th century and embrace healthcare rather than illness care as we move forward. And brain health is a fantastic opportunity to do that.
Thanks a lot, Greg. Paulo, I promised we would come back to you on the basis of the various points that were raised. As you're picking up the mic, I'd like to invite anyone to think of a question you may have. Antonella, I'm coming to you right after Paulo. And Steph, I know I missed you on the first panel, so if you've got a question, no, okay, not this time. Paulo, please.
Yeah, thank you. Thank you. I mean, I think it is important for us all to reflect on a few things before we engage in the Q&A, right? The first point I really like to make is that the moment we're living through right now, and let's say our concerns around mid to late life mental health or brain health are really a consequence of the biggest biological change in the history of the species, which is the massive increase in life, right? In the beginning of last century, average life expectancy was 30 years. In Japan now, the first generation has been born in which the majority of people will reach 100 years. Our brains were not equipped for this, right? So we were equipped basically by natural selection to live until we're 30, 40. So now we're trebling that life expectancy, and obviously that comes with a burden. So in some ways, it's a good thing that we're living through this crisis because it means we're living much longer. Now, of course, our health systems for the large majority of the last century have focused on acute care because the goal was increasing life expectancy. So curing infectious, diseases, vaccines, now trying to cure cancer, et cetera, chronic diseases, and especially brain diseases, have been a bit forgotten, by the way, because it wasn't seen as a societal imperative. I hope, and I think that's changing now, because as we age, the expectations from society and from individuals, from all of us, is that we age healthily and that we can keep our autonomy, our functioning much later in life than maybe we all expected or hoped to, right? So nowadays, if I'm in my early 50s, I expect to have a healthy brain up until my late 80s. That wasn't the case even a generation ago. So how do we do that? The second point I'd like to make is related to that. So it is actually great that we see some interventions work. Our improvement in cardiovascular health, for example, back to your initial point, how does it all fit together? Well, we know now if you increase cardiovascular health, if you increase metabolism, if you actually improve metabolism, if you increase movement, as was mentioned by Peter, if essentially you increase social active life, yes, you have lower rates of dementia. The Framingham Heart Study has proved that conclusively. Actually, the incidence of dementia is decreasing in areas of the world that have improved cardiovascular health. So the incidence is decreasing simply because of that, because of healthier living, which includes society, which includes movement, which includes diet, which includes a number of other things. Of course, it's hard to scale up those efforts, but it's good that we see that some interventions work. Now, the point then is, why aren't we doing better? Well, I think part of it, as I said, is that investment in research in brain health has been lagging behind most other areas of medicine and biology. And the pharma industry is as guilty as anybody else, right? We don't put as much money into this as we put into cancer development of therapies, right? So then we are now aging further. We have increasing rates of Alzheimer's, of Parkinson's, of other dementias, of mental health problems, and we don't have medicines to help us. We don't have diagnostics, right? So that needs to change, and that cannot change unilaterally. It can't only be that now let's say academic institutions put a lot of research money into Alzheimer's or Parkinson's or mental health, and that industry doesn't. No, that has to come in hand. It does, and at the same time, governments, right, regulators, cross-functional bodies, all of us need to work together to change that in the same ways that as I think was mentioned during COVID, we showed we could work collaboratively across the globe towards a very meritorious health goal. I think this one is equally as important, perhaps even more so. And the reason I say that is really my final point, is that I think we're finally coming to the realization that actually brain health and healthy aging is not only important for the individual, it's certainly important for the individual, right? None of us wants to age and lose our memories, our dreams, our connections with society. We all want to maintain our autonomy, our independence. We're all going to be asked, unfortunately, to work until much later in life as well, given the burden in our social security systems, etc. So individually is very important, but societally is very important as well, because the invisible costs of lack of brain health are really what's going to drag us all down. As a society, right? We cannot simply afford having people who are not aging healthily and don't have full brain functioning until much later, because the burden on them is big, but the burden on their caregivers is very big. And the burden on society, the loss of productivity, the loss of that brain capital is really going to drag our societies down. So that needs to change. Now, part of that change, and I'll end there, is just the awareness of the problem, right? I mean, we're very proud, and Simona Skrjanek, my colleague, is here, to have sponsored the brain health, initiative and the brain health atlas, just the mapping out for society of the real costs of brain health or lack of brain health. As soon as that realization sinks in, I think there's a call to action that needs to be attached to it. And that call to action has to be towards the development of new therapies, the development of new diagnostics, to increasing the resilience in healthcare systems, and yes, to promote a certain type of healthy lifestyle that I think will serve us well for the future.
Thanks for that. Actually, there is not much more I could add to everything you said, because you framed it beautifully and eloquently. Also in relation to what we call at EBC, creating an enabling framework to support the ecosystem, and what you were saying about investments, both from the public and private sector, would be equally important. What we realize is that on both sides, there's probably a kind of risk-adverse attitudes that ought to be overcome to some extent. Now, turning to the floor, Antonella, you were the first one, and others who would like to make a comment. George again, and the back, Pawel. Okay, I'll take those 4 contributions and then back to the panel. Antonella.
Thank you so much. For those who don't know me, my name is Antonella Santuccione-Ciada, and I am one of the co-founder of the Women's Brain Project and the current pro bono CEO. That said, we are, many of us, coming back from Davos, which just concluded last week. And what we've learned with many initiatives in Davos is that we have a 1 trillion investment, return on investment opportunity if we increase research in what we define women's health. There was the launch of the Global Female Health Coalition at Davos. And if I may, I think that the biggest opportunity it is to invest in sex and gender precision medicine for exactly women's brain health. We heard that majority of the patients that suffer of brain and mental conditions are women. Women represent also the highest number of caregivers. And thanks to a study that was conducted with the support of Roche last year, launched on the 8th of March, Women's Day, what we have learned is that the fact that women are caregivers represent a missed opportunity for our GDP, because basically we stop working and we're not productive anymore, though we have invested in the education of these highly skilled individuals. So I think that one of the reasons why neuroscience and brain health didn't have also the investment needed to advance the science further, it's maybe also because patients were majority women, and because the unpaid and paid caregiver is carried out by women. So we know that there is a huge gap in the entire health ecosystem when about therapies and diagnostic tools that can recognize specific unmet needs for the female population. And why this is matter, well, I'll give you another example. I belong to the team of scientists that developed aducanumab. And when the data about aducanumab got published with the FDA medical review, appeared clear that there was a trend to have less effect in the female included in the trial. Now, when we look at Gante data, when we look at the drug from Eisai, basically the trend is confirmed. At the Women's Brain Project, we are doing a meta-analysis on this. We are going to publish this data soon. So it's not just about the numbers of patients, but it's also the way treatments function for patients, whether men or women. And we have to consider this very carefully from a clinical developmental perspective, preclinical research, regulatory science needed, and also the way we invest in the research that we are doing, because anyone who doesn't do that type of research bears the responsibility of not including half of the planet population in the studies that are undergoing. I conclude saying that the follow-up of the study that we did thanks to Roche last year with the Economist Impact Unit that pointed out to the lack of return of investment when not doing sex and gender research is now done also in the UK scenario. We are trying to deep dive the research, analyzing what we miss when we don't do this type of approach for multiple sclerosis and Alzheimer with UK data. And yeah, so we are gonna learn even more and deep dive in the exercise. Thank you.
Awesome. Thank you, Antonella. And we are really looking forward to hearing from the conclusion of these studies. I'll ask the panelists to reflect on the contributions from the floor for your conclusions. We still have one intervention before we can break for lunch. So we're taking the 3 more comments. George, you keep it for later? Okay. So Mr. at the back and then Pawel afterwards. Okay.
Thank you.
Can you please introduce yourself?
I'm Arun Jha. I'm a oldest psychiatrist in the UK, and I was very interested to hear from Professor Gregorici about the midlife memory health problems. And because Professor Ije has done a lot of work in brain health, I would ask a question. When we see patients in the memory clinics, a lot of patients we diagnose suffer from mild cognitive impairment, and we virtually do nothing for them. We just discharge them and they come back in 2, 3 years, 4 years time with dementia. How can we address this issue of training our memory clinic clinicians to start working on brain health so that we can prevent this cognitive impairment? And I feel frustrated because we are trying to set up something like that in Hertfordshire in the UK where I work in St. Albans, but our managers do not listen to us. They are obsessed with the dementia diagnosis rate so that other things become secondary. So I will be very interested to see Professor Rich's comments and other comments.
Okay, thanks a lot for that. So Craig, you have a direct question to answer to in a minute. Maybe I'll ask you to keep it brief when you do respond. I'm taking a last question.
Okay.
But you guys may be out to connect also offline. Pawel.
Thank you, Fred. I'm Pawel Swieboda from NeuroCentury, ICFG, FIPRA, and the Brain Capital Alliance. And I want to ask about something which I thought was a bit of an undercurrent in the discussion, namely this sort of tension between trying to elevate brain health as a priority of its own versus brain health as part of the wider approach to staying healthy in life, right? And of course, there is no easy solution. My own take is that we need to do both, meaning we need to elevate brain health because it's not, it is underperforming in policy and in terms of the societal priority that is given to it. But at the same time, you know, we need to have brain health as an add-on to different other horizontal policies, especially prevention. It doesn't make sense to do, you know, prevention for cardio, prevention for neuro, prevention for mental, but you need to be able to explain, you know, what is brain specific that is needed in prevention and sort of formulate this as a powerful add-on set of policies and approaches. So my question would be if you see any magical formula for doing these two things at the same time.
What's great is that you're setting the agenda for next roundtable like this with this question. Kwasi, maybe I'll ask you to start the round of very quick conclusions, as I'd like to be able to have our last speaker before lunch.
Well, I think just Pawel's question, I think I go back to the points around the power of good information and the power of participation. So we recognize now in terms of lifetime risk, if we can give that information to our youth, to younger generations, and actually they think more about care rather than illness and are aware of the risk factors and manage those risk factors, it creates a movement, I think. It creates a group who I think will then start to think about those issues that extend to issues around sustainability. But you're right, we need to have clarity of message and clarity of mission, I think, to make sure that, you know, that doesn't get lost amongst the policy debate.
Thank you. Craig, you had a direct question. Please answer to it super shortly. And if you have a word of conclusion,
okay,
I'd like to hear. And Peter, I'm turning to you right after.
Thank you very much. So number one, the response to that question is, I think this is a problem, the legacy issue I referred to about seeing Alzheimer's disease, neurodegenerative disease through the prism of dementia. And therefore, if you don't have dementia, you don't get a service. And that's why we set up brain health clinics in Scotland. They're picking up across the rest of Europe and UK, people like Giovanni Frassoni, etc. It's a new narrative. It's about neurodegenerative disease, the brain disease, not as a cognitive disorder that presents in later life. While I've got the mic, and just want to say three more things. Antonella picked up about the issue about women. And I think there was a mention earlier about concussion and sport. Let's not forget the highest prevalence of head injury is actually women as subjects of or victims of intimate partner violence. So let's not forget that when we talk about head injury and concussion. And I think the key thing I would like to finish on is this change of narrative brings in other stakeholders. Alzheimer's disease is not a mental health condition, and I say that as a psychiatrist. The most important advocates for this within the medical fraternity, sorority, is actually public health. And I think we need to have much more conversations with public health practitioners. They have the expertise about risk identification and prevention, not psychiatrists, not neurologists. And thank you for giving me the chance to make some concluding remarks.
No, thanks, Craig, and thank you for joining us. Peter, on to you.
Yeah, very shortly, in addition to what you asked, what can I do for a patient with MCI? I think there is the Lancet Commission summary where you quite nicely can see that non-genetic factors like hearing loss or lack of movement and things you can do. So I would say instead of just saying I have that, you can actively do something, and each patient can do that. Second thing is, I've pointed out two things: information. So informing the young ones about these issues to start early, it makes a change, as I have shown. The second thing is, I think the time has come that we should install programs. I think we know most of the facts, but we need to go for programs which actually show their effectivity. That's my final plea.
Yeah. Thank you. Thank you very much, Peter. Maria Teresa, over to you.
Yes, I echo what has been said so far, and I'm super supporter of the idea of informing and increasing resilience and having this healthcare approach. The closing remark that I would like to give actually goes back to something that Harris mentioned before that I really like, that we have to work as a brain, as a huge brain network. We are all neurons connected somehow and working together. So if we want to really change this ecosystem, we have to connect all of us and work all together. And I encourage everybody to increase even more the communication and the working with patients, because actually listening to the voice of patients in the past would have helped us in many ways. So we should try and do it more in the future. I'm thinking about the voice of women in clinical practice, in science, but it applies to all sorts of groups. So this would be my final remark: to work as a beautiful network and having everybody at the table.
Thanks a lot. Thanks a lot, Maria Teresa, and thanks for joining. Paulo, you're the last one.
Thank you. Really fascinating conversation this morning. So just 3 points from my side. First one, in kind of direct response to your question, Pawel, I don't think anyone has a magic solution to this, but I don't think they're dissociated. I think we need to think about health globally, and that includes brain health. In the same way that 50 years ago, we decided it was not acceptable to live on to be 80 with 5 heart attacks and 3 strokes, and we took action to prevent that, I think we need to raise the bar on what our expectations are for healthy brain aging as well. So it is not dissociated in my mind. Now we need specific actions for things like Alzheimer's or Parkinson's or mental health, etc., but it's not dissociated from global health. My second point is around something that, Antonella mentioned that I really like, which is the need to have more inclusive and more diverse research. We still don't really understand how these diseases differ across, for example, gender, male or female, but also across the globe, between Africa and North America and Europe, between different cultures, different genetic backgrounds. We need to invest a lot more in understanding just how variable these conditions are and also how variable healthy aging is, right? And my third point is really kind of to end on a high note. I think these are very exciting times because at the same time that we have all these massive global health problems, there's never been more of an opportunity for us to make a difference because of the advances in science, because of the advances in technology, our ability to collect data, actually our ability to develop medicines. We've seen the approval of the first new therapies in Alzheimer's in the last 2 years, and that's really great. The challenge ahead is how can you build on that and accelerate it? And I really think this will take a collective effort, not just from pharma or academia or governments, or all of us need to work together to make it happen.
Yeah. Well, I think it's music to our ears. I think it deserves a round of applause. Thank you very much. Thank you everyone online for joining. I think, Paolo, you provided the perfect launchpad for our next speaker. To conclude maybe and wrap up the conversation of this morning, we were emphasizing the need to get the perspective of experts by experience, and we are gifted to have with us Orla Galvin, who is the Executive Director of EFNA, the European Federation of Neurological Associations, which is a very strong founding member within EBC, representing patients in the neurological space. So Orla, I'd like to invite you to comment from your perspective, but also to maybe give a sense on how to conclude all what you've been hearing so far in our conversations. Over to you.
Thank you so much, Fred. And indeed, I will try and end on a positive note. And I do hope you all had a delicious breakfast and can stay for a few more moments for this intervention. For those of you who don't know EFNA, we are an umbrella organization of other pan-European neurology patient advocacy groups. And an easy anagram for you to recall what we do is to think of the word ACE, where A stands for advocacy and policy actions, C, much like today's event, collaboration and communication, and E, empowerment and capacity of other neurology patient advocacy groups. For those of you in various parts of the world, you may not be aware of the weight and the power, as Fred has mentioned, of patient advocacy groups. And if I can briefly give you an example, EFNA works very closely with the European Medicines Agency. We hold an MEP interest group meeting on brain health and neurological conditions. There are 39 MEPs who are part of that at present. Last year, EFNA received the status of non-state actor with WHO Europe, as have one of our pan-European umbrella neurology organizations as well. Then at the global level, EFNA serves as the secretariat for a multi-stakeholder partnership called the One Neurology Partnership. And again, EBC are involved in this too. And through that partnership, we engage with other regional offices of the WHO and indeed have a routine dialogue with the brain health unit of the WHO. If I may, before I share some slides with you, name check, if I could call it that, 2 individuals very relevant to today who absolutely foster the co-creation and early dialogue with patient advocacy groups and deal directly with patients and caregivers. And that's Eyre and Stephanie Ludwig from Roche. And we can only say, please look at these excellent examples of embodying that culture of early dialogue and working with the groups that you're trying to serve. So reflecting on this discussion today, it was really interesting to hear about health and disease and moving towards what we want to improve, and that's brain capital. And what we mean by that is actually the lives of people building on brain capital and building on our brain skills. So if technology serves me well, I'll be able to share my screen with you. Wonderful. So I'd like to take the next couple of minutes to talk to you about how brain capital and investing in brain skills is something that the entire spectrum of the neurology and patients and caregivers community can adhere to and support, and give you some insight on the impact and perspective from our community. We take a brief moment to look at the global challenges. And when we look at these global challenges, I'd invite you to consider how addressing and tackling brain capital actually will provide solutions to each of these around where we need to invest our funding, where we need to provide resource. A study by EFNIT in 2020 indicated that 92% of people living with neurological conditions daily experience stigma. We do know that there is a very broad spectrum of neurological disorders, and in trying to tackle some of these issues individually, people are working in silos. And again, this is a lot due to the underfunding and the lack of prioritization of neurology and of brain health. We see a lack of inequity across the globe and a lack of clarity around what's included in neurology. And then this is exacerbated by some of the conversations around brain health as well. But as Fred said, we can save that for a roundtable on another day. However, something that is uniting and unifying is the conversation and the framework around brain capital. It's absolutely relatable, and it impinges and reports directly on not only patients, but caregivers as well. We unfortunately know that the societal and economic impact of living with a neurological condition is vast. It touches all elements of an individual and family's lives. We're also unfortunately too familiar with how the invisible and visible issues around living with a neurological condition have an impact that is quite significant on employment and the financial stability of individuals and families affected by neurological conditions. If you take a look at the image on the left-hand side of your screen, you might immediately think of, okay, neurological conditions, this might relate to patients, this reflects their medical status, but actually for the vast majority of people living with neurological conditions, their neurological condition is chronic, and for many it's unfortunately progressive. And this is something that impacts their life for many, many decades. So in a study conducted in 2022, which interestingly was designed to address gender-related issues, and I can tell you that slightly over 80% of the respondents were female, or identified as female, and the number of respondents were 1,085. I would like to share some stats with you around the current state of play. 69% of those 1,085 people indicated that they missed days of work as a direct result of dealing with their neurological condition. 76% of people experienced a negative impact on their relationship with their colleagues as a direct result of the neurological condition. 83% of people experienced a negative impact on their finances. And again, this was slightly worse for women than men. 85% of people experienced a negative impact on their relationship with friends. Again, some of this relates to the stigma, discrimination, and isolation that people living with neurological conditions face. 86% of people experience a negative impact on their relationship with their family. You can see the numbers are just going up and up. 94% of people experience a negative impact on their social life. And so it's no surprise that actually 99% of people living with a neurological condition experience an overall negative impact on their well-being. However, the situation is not as dire as it may seem. There is hope, and hope, as you know, for many patients and families affected with neurological conditions is an absolute lifeline. I would like to draw your attention to some of the brain skills outlined in this paper by Harris and colleagues. And these are areas that we can tackle and address and empower patient groups as well to promote optimal brain capital in a given family, in a given region, and indeed right across Europe. And some of these come up in the conversation today. We talk about fluid intelligence and intellect, the ability to innovate, have imagination and improvise, communication, cognitive flexibility, memory. We recently, and I think in the last panel, spoke about resilience. Our curiosity, creativity, and exploration, having good systems thinking and goal engagement, self-control, motivation, why are we here today, opportunity recognition. We have so many skills on our fingertips, what really we mean within our brain. And there is a lot of hope and a lot of opportunity that we can collaboratively tackle. And you can put this under the umbrella of brain capital or brain skills to support the community that we're talking about. And as much as I can say this for neurology, this is also reflective, I'm sure, for the mental health community and psychiatry community as well. So I'll stop there and hopefully leave you with some positive approaches that you might be able to take in your discussions during lunchtime. Thank you very much.
Thanks a lot, Ola, and that's a wonderful way to actually conclude our morning. We are now going to break for lunch. Thanks a lot for being with us today.